Did you know that varicocele, a condition where the veins in your scrotum become enlarged and swollen, is the most common cause of male infertility? And that varicocele can also lower your testosterone levels? These are some of the surprising facts that show how relevant and important varicocele is for your health and vitality. Welcome to this video on varicocele. In this video, we will explain what varicocele is, how common it is among men, how it affects your health and well-being, and how you can treat it with some simple and effective strategies. What is varicocele? Varicocele is a condition where the veins in your scrotum become enlarged and swollen. These veins are part of a network called the pampiniform plexus, which carries blood from the testicles back to the heart. Normally, these veins have valves that prevent blood from flowing backwards and pooling in the veins. However, sometimes these valves fail or are absent, and blood accumulates in the veins, causing them to dilate and form a varicocele. A varicocele usually occurs on the left side of the scrotum, but it can also occur on the right side or on both sides. Varicocele is a very common condition that affects about 15% to 20% of all men. It often develops during puberty, when the testicles grow rapidly and increase the blood flow to the scrotum. It can also develop later in life, due to aging, injury, or other factors. Varicocele is more common in men who are tall, overweight, or have a family history of varicocele. Symptoms of varicocele. Varicocele can cause a range of symptoms that can affect your physical and emotional well-being, such as pain or discomfort in the scrotum, especially when standing, sitting, or exercising. A feeling of heaviness or dragging in the scrotum. A lump or mass in the scrotum that feels like a bag of worms. A difference in size or shape of the testicles, with the affected testicle being smaller or softer. A decrease in sperm count, quality, or motility, which can lead to infertility or subfertility. A decrease in testosterone levels, which can affect your sex drive, mood, energy, and muscle mass. These symptoms can interfere with different aspects of your life, such as your relationships, work, hobbies, and self-image. Complications of varicocele. Varicocele can also lead to some complications if left untreated, such as testicular atrophy, which is the shrinking of the affected testicle due to reduced blood flow and oxygen supply. Testicular torsion, which is a medical emergency where the testicle twists and cuts off its blood supply, causing severe pain and swelling. Hydrocele, which is a fluid-filled sac around the testicle that causes swelling and discomfort. Varicocele rupture, which is a rare but serious condition where the varicocele bursts and causes bleeding and infection. Treatments for varicocele. Varicocele can be treated by various methods depending on the type, severity, and symptoms of the varicocele. The treatment options include: Number 1. Watchful waiting. This is an option for mild or asymptomatic varicoceles that do not affect fertility or testosterone levels. It involves regular monitoring of the varicocele and its effects, and seeking treatment if the symptoms worsen or the fertility is impaired. Number 2. Medications. These can help relieve the pain or discomfort caused by the varicocele, but they do not treat the underlying cause or prevent the complications. They include anti-inflammatory drugs, such as ibuprofen or naproxen, and analgesics, such as acetaminophen or paracetamol. Number 3. Surgery. This is the most common and effective treatment for symptomatic or problematic varicoceles. It involves tying off or removing the affected veins to restore normal blood flow and reduce the pressure and size of the varicocele. There are different types of surgery, such as open surgery, laparoscopic surgery, or microsurgical surgery, and they vary in their invasiveness, recovery time, and success rate. Surgery can improve the pain, discomfort, testicular size, sperm quality, and fertility in most cases. Number 4. Embolization. This is a minimally invasive alternative to surgery that involves inserting a catheter into a vein in the groin or neck and guiding it to the varicocele. Then, a coil, a balloon, or a sclerosing agent is used to block the blood flow to the varicocele and shrink it. Embolization can also improve the pain, discomfort, testicular size, sperm quality, and fertility in most cases, but it may have a higher risk of recurrence or failure than surgery. The choice of treatment for varicocele depends on your personal preference, medical condition, and fertility goals. You should discuss the pros and cons of each option with your doctor and make an informed decision that suits your needs and goals. Myths and misconceptions of varicocele. Myth number 1. Varicocele is a rare condition that only affects a few men. Fact: Varicocele is a very common condition that affects about 15% to 20% of all men. It is the most common cause of male infertility, affecting about 40% of men with infertility problems. Varicocele can affect men of any age, race, or lifestyle, but it is more common in men who are tall, overweight, or have a family history of varicocele. Myth number 2. Varicocele is always painful and noticeable. Fact: varicocele is not always painful and noticeable. Many men with varicocele have no symptoms or signs and may not even be aware of their condition. Varicocele may only cause mild or occasional pain or discomfort, which may be relieved by lying down or wearing supportive underwear. Varicocele may only be visible or palpable when standing, coughing, or straining, and may disappear when lying down or relaxing. Myth number 3. Varicocele does not affect fertility or testosterone levels. Fact: varicocele can affect fertility and testosterone levels in some cases. Varicocele can cause a decrease in sperm count, quality, or motility, which can impair the ability to fertilize an egg. Varicocele can also cause a decrease in testosterone levels, which can affect the sex drive, mood, energy, and muscle mass. Varicocele can also cause oxidative stress and inflammation in the testicles, which can damage the sperm and the hormone-producing cells. Myth number 4. Varicocele can only be treated by surgery. Fact: varicocele can be treated by other methods besides surgery. Surgery is often not required for treatment of varicocele, especially if it is mild or asymptomatic, or if fertility is not a concern. In some cases, varicocele can be treated with medications, such as anti-inflammatory drugs or analgesics, to reduce the pain or discomfort. In some cases, varicocele can be treated with embolization, which is a minimally invasive procedure that blocks the blood flow to the varicocele and shrinks it. Myth number 5. Varicocele is only related to physical health. Fact: varicocele is also related to emotional, psychological, and social health. Varicocele can affect your self-esteem, confidence, and body image. It can also affect your relationships, intimacy, and sexual satisfaction. It can also have cultural, religious, and ethical implications, and may be influenced by social norms and expectations. These are some myths and misconceptions that surround varicocele, which can be harmful and misleading. It is important to seek factual information and scientific evidence to dispel these myths and misconceptions, and to make informed decisions regarding your condition. So, what can you do to take care of your health and well-being and prevent or manage varicocele? Here are some practical tips for self-care and lifestyle modifications that may help you. Number 1. Monitor your condition regularly. Check your scrotum for any changes in size, shape, or appearance of the veins or the testicles. Report any new or worsening symptoms to your doctor. Seek immediate medical attention if you experience severe pain, swelling, or bleeding in the scrotum, which may indicate a complication such as testicular torsion or varicocele rupture. Number 2. Wear supportive underwear. Choose underwear that provides adequate support and comfort for your scrotum, such as briefs or boxer briefs. Avoid underwear that is too tight or too loose, which may cause irritation or pressure on the veins. You may also wear a scrotal support or a jockstrap during physical activities or exercise to prevent excessive movement or trauma. Number 3. Maintain a healthy diet and weight. Eat a balanced diet that includes plenty of fruits, vegetables, whole grains, lean proteins, and healthy fats. Avoid or limit foods that are high in sugar, salt, or trans fats, which may increase inflammation and oxidative stress. Maintain a healthy weight and body mass index (BMI), as obesity can lower testosterone levels and increase the risk of varicocele. Number 4. Exercise regularly and moderately. Exercise can improve your blood circulation, cardiovascular health, metabolism, and mood. Aim for at least 150 minutes of moderate to vigorous physical activity per week, and vary your intensity, duration, and frequency. Avoid or limit activities that may cause trauma or pressure to the scrotum, such as cycling, horseback riding, or weightlifting. Number 5. Manage your stress levels. Stress can increase your cortisol levels, which can interfere with your testosterone levels and sperm quality. Practice some relaxation techniques, such as deep breathing, meditation, or yoga, to calm your mind and body. Engage in hobbies, activities, or sports that you enjoy and that make you happy. Seek social support from your family, friends, or community and share your feelings and concerns with them. Seek professional help from your doctor, therapist, or counselor if you have any mental health issues or need guidance and advice. Number 6. Avoid smoking, alcohol, and drugs. Smoking can damage your blood vessels, reduce your blood flow, and increase your oxidative stress. Alcohol can lower your testosterone levels, impair your sperm quality, and affect your liver function. Drugs can alter your hormone levels, affect your sperm quality, and cause addiction or dependence. Quit smoking, limit your alcohol intake, and avoid recreational drugs to improve your health and well-being. These are some practical tips for self-care and lifestyle modifications that may help you prevent or manage varicocele. However, they are not a substitute for medical advice or treatment. If you have any concerns or problems with varicocele, you should consult your doctor for diagnosis and treatment. In this video, we've covered everything you need to know about varicocele, from its prevalence to its impact on male fertility and hormonal balance. Did you know it's the leading cause of male infertility and can lower testosterone levels? We've revealed common myths surrounding varicocele, providing accurate information to help you make informed decisions about your health. Plus, we've offered practical tips for self-care and lifestyle adjustments to manage varicocele effectively. If you found this information helpful, don't forget to like and subscribe to our channel for more health-related content. We also welcome your suggestions for future topics. Thanks for watching, and remember, organize your health is key to living your best life.